in back pain, there's something called the QL, which is, I call it the QL because the real name is the quadratus lumborum. And it totally makes me mad because every anatomical image you see in a book makes it look puny. And if you see it on a cadaver, it's huge. And when your QL spasms and you see it looking puny in a book, it pisses you off because you know that a muscle that small could not cause that much pain, you know? And it is across the entire back, 2 pieces, attaches all along the top of here, doesn't attach to the 5th lumbar, but to L4 through L1, and then across the lowest rib. When that gets tight, it pulls this all together. We already have gravity pulling us together. And then you add tight muscles pulling us together. The discs act, I have to say that slowly, as spacers. The intervertebral discs. So you can see that in this guy. They're shock absorbers, but they're also spacers. Spacers to create enough space so that where the nerve roots come out, there's room. And there's not bone on bone or bone on nerve compression. And part of what I love about yoga is all the movements we do help imbibe them with liquid so that they puff back up and we have that space. They self-hydrate until we're somewhere in our late 20s, early 30s. You know, once the hangovers start lasting, then all of a sudden your discs aren't hydrating either. And so we have to do that through movement. Forward bends, back bends, lateral bends, rotation, even inverting. All of that helps to imbibe these with more fluid so that we have more space. When this starts to get small, and I'm seeing a lot more of this. Anyone here have degenerative disc disease? Yeah, you and me. Again, sisters for not a cool reason. Okay. That's not good. It's when the integrity of the discs start to just not be so integral and they're not holding the space. And when you don't have space in between here, you start to get bone on bone compression. Anytime a bone touches another bone, more bone grows. It's that cool thing about bones. That's why when they say to strengthen your bones, doing these kinds of weight-bearing sort of thing will create more bone. But when you don't have proper alignment, you can start to get excess bone in the joints, in the knees. Say the cartilage is like the intervertebral disc of the knee. I mean, similar material. The meniscus in the knee starts to wear away. You'll hear people say, well, I'm bone on bone in that knee. What that tells me is that bone on bone is creating more bone, and it's not nice, well-appointed bone. It's, you know, little bone chips and bone creating problems and getting into the joint space or creating tension here. And with enough bone on bone, fusion can start to happen. So you'll hear people, and I don't mean fusion like a surgical fusion, but fusion where the bones start to naturally fuse together. So that's why we need to do this movement in all areas to get the discs imbibed with fluid and to keep the muscles healthy. And we want the muscles strong, but we also want them limber. And one of the things, there's certain things that I learned along the way that I found shocking. Like to me, if you have, this one in particular tends to be pretty tight. And I always thought a tight muscle was a strong muscle. That is not true. A strong muscle is one that can be tight or can be totally relaxed. But when we get stuck in this constant contraction, that's not good because we can't relax. And then if it's locked, so generally speaking, if you look at the upper back, our rhomboids, which are muscles deep to the larger muscles of the back that bring the shoulder blades together. They're the ones that draw the shoulder blades together. With the royal R, you know, all Westerners, our lifestyles, that kind of thing, these tend to get locked short and tight, and then the upper back gets locked long and it's weak. So you can do this till the cows come home, but if you can't get enough opening here, you're not going to be able to strengthen these, because you got to be able to contract the muscle in order to strengthen it. Does that make sense? Okay. Any questions? Yes, Michael.
What is your opinion on inversion tables?
Ah, good question. The question was, what is my opinion on inversion tables? I think that I think they can be really good. I've heard they're making better ones that don't break your ankles. That was my big complaint when I used them. I always tell people, don't go straight up and down initially. Go at an angle, and then kind of work your way up to being straight up and down, and maybe you're never all the way straight up and down. If someone has a tendency to spasm, I would almost say don't go straight up and down. Because once you start spasming, it's extremely painful, and it's hard to get out of it safely. Or do it with someone else around, so that you're, maybe I should learn from that one, so that you're not stuck there and not able to get out. And part of the reason, I have a good friend who has degenerative disc and blown discs throughout pretty much his entire lumbar spine, probably even higher. And then he also has spinal stenosis. And he was in one time and went into spasm, and he said it was the most excruciating thing in his life. But he's a dude, and he just went straight up and down, and I'm like, Andy, you gotta, tolerate it. However, I think it's awesome for the decompression aspect of it. Yeah, good question. Yes?
So after my injury, they told me not to do an inversion table, but I have a chair. And there's only like 2 on the market, but because you're like this when you're inverting, it's supposed to help with, I don't know, the way that your spine is when you're in that chair. Anybody's welcome to come to my house and use it.
Cool, so it's the inversion chair. I think I've seen those. Does it move your knees?
And what it does is it keeps you're in a seated position and you go back. And I definitely don't go all the way upside down.
So you start like you're sitting in a regular chair.
Yeah, you get in a chair and you sit, and then it's very easy to use, and I go back, and you can change the angle of how far back you do go, but they said the table, something when you're sitting like this, I don't know, you probably know exactly what this is, but when you're sitting like this, you're doing something to your spine. You're with the curvature of your spine, so then when you go upside down, the traction's better.
Yeah. So I'm just trying to visualize it, and then you come back. So you're not going straight up and down, and then the fact that the knees stay bent, yeah, it keeps more the natural curve of the lumbar without full gravitational pull lengthening the lumbar.
So it's more like a zero gravity.
Yeah. Yeah, more like zero gravity than a full-on. Yeah, I'm glad that's helping you. Yeah. I'm going to show you some of my. First of all, my house is kind of like a yoga jungle gym. Not as much, the last house was really bad. I mean, I would do yoga pretty much everywhere. But sinks are wonderful for tractioning your spine. And then you can control it, providing you don't have torn rotator cuffs. But if you stand at a sink, and I'm always one about taking the hamstrings out of the equation. So bending the knees will do that. Pull the belly in, come over, and then you're holding the sink, leaning back. How funny would it be if I just went flying? Leaning back, and then if you have someone around who could gently grab your hips and lightly traction, that's another nice way to do it. I'm not a fan of hanging, just because of what it does to the rest of the joints. But something about that, the lean back, hold on, and then keep the belly pulled in, take the hips slightly one way, breathe into this side. That's going to get the QL. Then take the hips the other way, breathe into the other side. The QL, again, it's on both sides. Sometimes just one gets tight. And so you'll see this. And generally, if you see this kind of alignment, you're going to assume someone has scoliosis. Not necessarily true. They could have a tight QL that's pulling that up. And if you lengthen the QL, it'll come back to some. We all have scoliosis to some degree or another because we're all perfect, but we're not all perfect. We're asymmetrical. Since we have some pain going on, I thought we could do a little bit of asana. And I'm going to call it my, you're so cute. I have certain things. For one, if you're in a lot of pain, doing an hour-and-a-half asana, probably not going to be all that helpful. I call it yoga snacks, where you're doing something a little bit throughout the day. And quite honestly, you can do yoga in bed. Who here does yoga in bed? Let's be honest. Yeah. Because, yeah, before you get up, hugging the knees into the chest or doing one knee at a time, breathing, being nice to yourself, slowly getting up. Coming home from work, to me, this is a beautiful practice. Come home from work and do legs up the couch and breathe and work on relaxing. So people who have known me the longest know that turmeric and legs up the wall, I think, cures everything. You know, damn near. That being said, if someone is on a blood thinner, or some people can't take turmeric, so you want to make sure it's okay for you. If you're on Coumadin or some kind of blood thinner, you need to check with your doctor. I have one cancer patient who did that and was able to bring the turmeric in and bring the Coumadin down enough, because they're both blood thinners. And if you're on a blood thinner, there's a reason, and you don't want to have internal bleeding that you don't know about. Drinking a lot of ginger tea, anything that's anti-inflammatory. You can, again, as I'm aging, I'm bruising more, so there's some days I don't take the turmeric, because if you notice yourself bruising, that's the blood thinner doing that. But turmeric and legs up the wall, and if you have tight hamstrings, legs up the wall is against the Geneva Convention because it's just torture, being straight up and down. That being said, legs up the couch is awesome, and it's not quite as going straight up and down. You only want to stay about 10 minutes because you're slowing blood supply to the legs. I've stayed too long, and it's not pretty. You know, I mean, nothing was bad, but I couldn't walk for a little bit. I mean, it just felt weird, like, yeah. But legs up the wall, you can nap. I'm sorry, legs up the couch, you can do for, half an hour. And what that does, when the spine is completely flat on a hard surface like the floor, it's going to start to realign. You deepen the breath and relax.